Dear students, welcome back. In the previous session, we have discussed about the muscles present in the entire lower limb. Now, we'll start osteology of the lower limb with hip bone. Hip bone is also called as innominate bone, and it is a large irregular bone. It is made up of three parts. One is the ilium, pubis and ischium. So this one is the ilium, here is the pubis and the ischium. Okay, the ilium is present superiorly, the pubis is present antero-inferiorly, and ischium is present posterior-inferiorly. The three parts are joined to each other to a cup-shaped hollow called as acetabulum on its lateral aspect. Okay, so the pubis and ischium are separated by a large oval opening called as obturator foramen. The acetabulum articulates with the head of the femur to form hip joint. The pubic parts of the two hip bones meet anteriorly to form the pubic symphysis. Okay, here another bone. Okay, the two hip bones form the pelvic or hip girdle. The bony pelvis is formed by the two hip bones along with the sacrum and coccyx. If you see the side determination of this hip bone, now we have seen the major parts of the hip bone, isn't it? Yes. In this hip bone, the acetabulum, which is directed laterally in the case of side determination. So acetabulum should be directed laterally. The flat expanded part of the ilium should be placed superiorly, or which lies above the acetabulum, and the obturator foramen lies below the acetabulum. And this obturator foramen, it is bounded anteriorly by thin plate of pubis and posteriorly by a thicker one called as strong ischium. Thin pubis anteriorly and posteriorly by strong ischium. So this is the side determination. So first we have to see whether the acetabulum is placed laterally. When you take the hip bone, so the acetabulum should be placed laterally, and the ilium should be in the superior aspect, whereas the pubis, this pubis part, which is thinner part, should be placed in the anterior aspect, and the ischium is placed on the posterior aspect. Okay, if you see the then we can identify the side determination. Okay, so this is the right hip. This one is the right hip external aspect. If you see the anatomical position, the pubic symphysis and anterior superior iliac spine. So here you can see the pubic symphysis and this anterior superior iliac spine. So these two are present in the coronal plane, same coronal plane. Okay, so the pubic symphysis and anterior superior iliac spine lie in the same coronal plane. That means these two present in the vertical line. If you place this hip bone against the wall, so this anterior superior iliac spine and the pubic symphysis will be in the same line. Okay, same vertical plane. So this is the anatomical position, and the pelvic surface of the body of the pubis is directed backwards and upwards. The pelvic surface of the body of the pubis. So here we can find the body of the pubis. So this body of the pubis will direct backwards and upwards. So the body of the pubis here, which is placed, so here on the, this is the anterior aspect, the body of the pubis is placed backwards and upwards. So here you can see backwards and upwards, this body. Okay, next, the symphyseal surface of the body of pubis lies in the median plane. So this symphyseal layer lies in the medial plane. So that we can see in the internal aspect of the ilium, we can find this median plane, that is called as symphyseal surface of the body of the pubis, which lies in the median plane. We can observe in that. Okay, so now, so the main three bones which constitute the hip bone are, what are they? The ilium, ischium, and the other one is pubis. So now we will see one by one in detail. The first one is the ilium. So this is the ilium bone. Okay, so this ilium is also called as flank bone, which forms the upper expanded plate like part of the hip bone. So this ilium is the expanded part of the hip bone. So its lowest part forms the, here this is the lowest part, forms the upper 2/5 part of, so it forms the upper 2/5 part of the acetabulum. So the ilium is having the following things. One is, it is having, so now we are going to consider only this ilium. The ilium is having an upper end which is called as iliac crest. So this is the upper end. This is the upper end of the ilium, and this one is the lower end of the ilium. So it is having two ends, upper end and lower end, and three borders: anterior border, posterior border, and medial border, and three surfaces: anterior surface, we can't say here anterior, so gluteal surface. So this one is the gluteal surface, and then the medial surface, we can say the medial surface is again divided into two surfaces. One is the iliac surface and the sacropelvic surface. So this iliac surface is nothing but the iliac fossa, this is the thing, and this one is the sacropelvic surface. Okay, so these are the surfaces. Okay, so now how many ends? It is having upper end and lower end. Okay, and it is having three borders: anterior border, posterior border, and medial border, and three surfaces: gluteal surface, iliac surface. This iliac fossa is called as iliac surface or iliac fossa, and a sacropelvic surface. So all these two constitute the medial surface, we can call it as. Okay, so now we will move on to the first part of the ilium, that is iliac crest. Okay, so here we can see the iliac crest. The iliac crest is a broad convex ridge forming the upper end of the ilium. It can be felt at the lower limit of the flank. So this is the upper end forming here, and this can be felt at the lower limit of the flank. If you see the curvatures, so it is vertically, it is convex upwards. So this is the convex upwards. Now we are keeping this bone in the vertical plane. So it is convex vertically upwards and antero-posteriorly. So anterior side also and posterior side also, it forms vertical convexity. The highest point of the iliac crest is situated little behind the midpoint of the crest. So the highest point of the iliac crest is situated little behind the midpoint of the crest, and it lies at the level of the interval between the spines of the vertebra L3 and L4. So normally, here this becomes the highest point of the iliac crest. So this will lies on the at the level of the L3 and L4. So if you see the ends of this iliac crest, now we are discussing about only iliac crest. Okay, so if you see the ends of the iliac crest, it is having an anterior end. This anterior end of the iliac crest is called as anterior superior iliac spine, and this can be easily felt in our body. And the posterior end of the crest is called as posterior superior iliac spine, and this position on the surface of the body is marked by dimple 5 centimeters of the second sacral spine. Okay, this can be seen on the posterior aspect of the lumbar region. We can find its lumbosacral region. Okay, now so this is about the iliac crest. Now if you see the divisions here, morphologically the iliac crest is divided into a long ventral segment and a short dorsal segment. Okay, ventral segment means anterior. Okay, so this becomes the anterior. So ventral segment forms more than the anterior 2/3 of the crest. So more than anterior 2/3 of the crest, it forms the ventral segment, and it is having an outer lip and inner lip and an intermediate area. So this is having outer lip, inner lip, and as well as the intermediate area of this ventral segment. So more than 2/3 of the crest is called as ventral segment. Okay, and the tubercle of the iliac crest is an elevation that lies on the outer lip. So this is the outer lip. We can see the outer lip here. Inner lip we can't see, and the intermediate part we can find. So this is the point here. This lies 5 centimeters behind the anterior superior iliac spine. Okay, this is called as tubercle of the iliac crest. This is called as tubercle of the iliac crest. Okay. Next, the dorsal segment forms less than the posterior 1/3 of the crest. It has a lateral and medial slope separated by a ridge. So at the posterior aspect, it is having 1/3 of the crest, and it is having lateral and medial slope, which is separated by a ridge. Okay, so this up to here, this is the ventral segment, and this one is the dorsal segment of the iliac crest. Okay, now we'll see the borders. So this is about the upper end. Now we'll see the borders. It is having 3 borders. One is the anterior border, posterior border, and medial border. So now we'll see the anterior border. This anterior border starts from the anterior superior iliac spine and run downwards to the acetabulum. The upper part of the border presents a notch, while its lower part shows an elevated area called as anterior inferior iliac spine. So we can follow this along with the bone. So the anterior border starts from the anterior superior iliac spine, and it is runs up to the acetabulum. Here the border is showing a notch like appearance in the upper part and an elevated area at the lower part, which is called as anterior inferior iliac spine. The lower half of the spine is large and triangular and rough. This is about the anterior border. Okay, now we will move on to the posterior border. The posterior border of the ilium extends from the posterior superior iliac spine to the upper end of the posterior border of the ischium. So now you can see, so this border will continue like this. Posterior border of the ischium. Yes. Up to here the border is extending. A few centimeters below the posterior superior iliac spine, it presents another prominent called as posterior inferior iliac spine. Okay, and still lower than the posterior border, it is marked up by a large deep notch called as greater sciatic notch. So this is the greater sciatic notch. Okay, so this is about the posterior border of the ilium. So here actually the posterior border ends up to acetabulum here itself. Okay, next it take over by this ischium on the posterior aspect. Now we will move on to the medial border. Medial border we can't see in this external aspect. We can see in this internal aspect of the right hip bone. This one is right hip bone. Okay, now the medial border extends on the inner or pelvic surface of the ilium from the iliac crest. So here you can see this is the medial border here. Okay, to the iliopubic eminence. So the border will continue to the iliopubic eminence. That means that ilium and pubis are joining here and forming an eminence here. So up to here this forms the medial border. So it separates the iliac fossa and the sacropelvic surface. Okay, its lower rounded part of the iliac parts forms an arcuate line or inlet of pelvis. So here it becomes very prominent, isn't it? This part is very prominent. So this part forms the arcuate line or inlet of pelvis. Okay, yes. So this is about the borders of the ilium. Now coming to the gluteal surface. So again we'll move on to the external aspect. So if you see the surface, so the surface, the gluteal surface is the outer surface of the ilium, which is convex in front. So which is convex in front and concave behind. Okay, like the iliac crest. So convex in front and concave behind, like the iliac crest. It is divided into 4 areas by 3 gluteal lines. So what are the gluteal lines here? One is the posterior gluteal line. This is the shortest, begins 5 centimeters in front of the posterior superior iliac spine. Okay, and run downwards to end up the upper part of the greater sciatic notch. So up to this upper part of the greater sciatic notch, this is called as posterior gluteal line. This is very, very important. You have to mention it in your viva also. Okay, next comes to the anterior gluteal line, which is the longest gluteal line, begins about 4 centimeters behind the anterior superior iliac spine, which runs backwards. So here which runs backwards and then downwards to the end of the upper border of the greater sciatic notch. So at the middle end, okay, this one is going to present. So the anterior gluteal line is the longest, begins about 4 centimeters behind the anterior superior iliac spine, runs backwards and then downwards to end at the middle of the upper border of the greater sciatic notch. Next comes to the inferior gluteal line. So this is the inferior gluteal line. The inferior gluteal line is the most ill-defined. So it is not clearly seen in the bone, which begins a little above and behind the anterior inferior iliac spine, anterior inferior iliac spine, and runs backwards and downwards near the apex of the greater sciatic notch. So all these lines are ending up at the borders of the greater sciatic notch only. Okay, yes. Now we will move on to the iliac fossa. So these are the important features we can see on the gluteal surface. Now we will see this iliac fossa. So this part is called as iliac fossa. The iliac fossa is the large concave area on the inner surface of the ilium, which is situated in front of the medial border. So this one is the concave area and situated in front of the medial border. It forms the lateral wall of the false pelvis. Okay. Now coming to the sacropelvic surface. Here we can see the sacropelvic surface here. Now the sacropelvic surface is an uneven area. You can, by seeing itself, we can say this is an uneven area on the inner surface of the ilium, situated behind the medial border. So this surface is present behind the medial border, and it is subdivided into again 3 parts. One is the iliac tuberosity. So this one is the iliac tuberosity, this part, the auricular surface and the pelvic surface. So this one is again divided into auricular surface and pelvic surface. So this is called as auricular surface. Okay, this one is iliac tuberosity and this one is auricular surface. Now the iliac tuberosity is the large upper roughened area. So it is present on upper side, and which is large and roughened area lying just below the dorsal segment. This is the dorsal segment of the iliac crest. It is raised in the middle and depressed both above and below. Okay, the auricular surface is articular but pitted. Okay, it lies anterior-inferior. So it lies anterior side and inferior side to the iliac tuberosity. It articulates with the sacrum to form sacroiliac joint. This surface forms the sacroiliac joint. The pelvic surface is smooth and lies antero-inferior to the, so in front of this. So in 3D we can find this surface very easily. Okay, so that forms the pelvic surface, which is smooth. It forms a part of the lateral wall of the true pelvis. Okay, true pelvis is formed by the pelvic surface of the sacropelvic surface, whereas this iliac fossa, this forms the lateral wall of the false pelvis. Okay. Along the upper border of the greater sciatic notch, so here along the upper border of the greater sciatic notch, this surface is marked by preauricular sulcus. This sulcus is deeper in females than in males. So this is all about the bony markings and bony osteological information about this ilium. In the next session we are going to discuss about the other two parts of the hip bone, that is pubis and ischium. Thank you.